Hi, I'm Dr. Varshi Bruman from South Texas Renal Care Group here in San Antonio, Texas.
And I'm Lorena Kaplan, an HB registered dietitian with Nutrition Services.
And today we're going to talk about the importance of potassium and potassium intake in our kidney patient population. As a nephrologist, potassium is an electrolyte that I have to deal with day in and day out because people with kidney disease cannot excrete their potassium or get rid of their potassium as effectively as the normal individual may. And potassium, although a very important electrolyte in cellular functions and certain bodily functions, is going to get us in trouble as kidney patients if we don't restrict our potassium intake.
Right, and as a dietitian, we look at all of our food sources, and you're going to find potassium in a lot of food sources. And so one of the things that we would do as dietitians is take a look at your diet and pinpoint which foods are going to be those high potassium sources, and then give you recommendation on how to swap them out. We've got some great examples of over here on low potassium fruits and vegetables. And they really can still provide a lot of substance in not only different flavors, but different recipes that you may be cooking right now. And so a dietitian would be great to be able to help you pull out, all right, what should we be substituting to really make sure you're not pulling in those high potassium fruits and vegetables and foods overall. Because we also have the nutrition facts label that can point us into what foods are going to be higher sources of potassium. As you see down below in the lower part of your nutrition facts label, you will have the content of potassium in each one of your labels. So we really start to pull in more education on how to learn more about your foods and where to find this information so that you're making the best choice for keeping your potassium down.
And I think that's very important. For me as a nephrologist, it's important to know what my patients are doing and for me to educate them on the clinical implications of taking too much potassium. I think the most important thing about high potassium levels is it can stop your heart. And that can be the end game. And I think it's a small price to pay to limit your potassium so that you don't have major complications like that, which can result in prolonged hospital stay or end of life, unfortunately. So those are the things we want to avoid. And I think it's important to also recognize that in certain geographies, certain food items are more popular that can result in high potassium. One of the things I learned here in South Texas was about cactus or nopales. Yes, nopalitos are consumed by our patient population here, and it's very popular. They have nopalitos and tacos and so forth, and breakfast items, other food items. And I did not know that. When I moved here, I realized, wow, that's a high potassium containing food item. So I think it's important to talk to your doctor, your dietitian, and really understand what food sources have and how much potassium they contain.
Absolutely, and the coordinated care between a nephrologist and dietitian is really important to make sure you're getting exactly what you need.
This is one of the biggest areas where our coordination of care is the most important.
That's right.